My name is Michelle Juma, and you're joining the January Life Unites Us webinar, Addiction, Parents, Caregivers, and Families. I'm the project management specialist at Shatterproof for their National Stigma initiative. And before we get started, I'll go through some housekeeping slides as people file in. So this event is being recorded, and a copy will be available on the Life Unites Us website shortly after we finish. You will also be able to interact with our panelists via the Q&A and the chat box. Please use those features as much as possible. However, the chat box will not be as closely moderated. All attendees will be muted throughout the session. For best audio quality, I'd recommend that you use phone audio, and you can switch from computer audio to phone by selecting audio settings on the lower left corner of your screen. If you get disconnected at any point in time, please follow the link from the original invitation. I'll be sure to let you back into the room. Today's agenda consists of our welcome, and then we'll move into a campaign overview, speaker introductions, and our moderated discussion, a question and answer portion, and then a wrap up where we'll highlight a few more of the resources that our speakers would like you all to learn more about. I'll now pass things over to Ashley Navratis, who will go over the campaign, the Life Unites Us campaign, but please continue to introduce yourselves in the chat box. I love how interactive you all are being, so thank you so much.
Thanks, Michelle. So happy to be here with everyone today. My name is Ashley Navratis. I'm a program coordinator on the National Stigma initiative team at Shatterproof. I work very closely with the Life Unites Us campaign, specifically on the community engagement portion of the work that we do. So I'm just going to spend a few minutes giving a high-level overview of the campaign and then talking to you a little bit about campaign partnership. Great. So for those of you who are not familiar, the Life Unites Us campaign is a stigma reduction, evidence-based public health campaign in the state of Pennsylvania. We are statewide, and the main goals of the campaign are to increase knowledge and education, and then reduce the stigma associated with people living with substance use disorder in the state of PA. And the main way that we do this is through story collection. Story collection is really the bread and butter of our campaign, and we work really closely with individuals in the state to be able to share stories of hope and recovery that we share through our social networks and our social platforms. But another really big component of the work that we do is the community engagement piece. So we partner with CBOs in the state to be able to reshare our content across their networks. We realized very early on that CBOs are trusted messengers throughout the state, and it's really critical to be able to connect with them and leverage the work that they're already doing in the state. Next slide, please. Yeah, so campaign partnership, and what does it mean? So we like to think of campaign partnership as a two-way street. As I mentioned before, we really look towards CBOs to reshare content. We also want to leverage the work that they're already doing with the populations that they're already serving. And we do that through opportunities like the webinar that you're attending today. So for anyone who has not partnered the campaign yet, I really look forward to speaking to you and getting to know the work that you do a little better. My contact information is listed there on this slide, and then our social media, which is on the next slide, has all the available opportunities where you can connect with us. If you know anyone who's willing and ready to share their story, that's always something that we're looking for as well in the state. So I will pass it over to Matthew Stemenko. He is the Vice President for the National Stigma Initiative team, and he will be moderating our webinar today.
Perfect. Thank you, Ashley. I'm really excited to be here and really excited to see such amazing attendance in the state of Pennsylvania. As many of you probably know, and certainly with what Ashley just shared, this is one of the most sort of innovative campaigns working to address stigma, and we're so proud to be able to partner with so many of the people that are on the call today. I'm also really excited to introduce two amazing guests who will share their story and how they've been impacted by addiction, and we'll have a brief discussion and hopefully get into a lot of questions and answers that you might have for them. So first, I'm going to start with introductions. I'll first introduce Stephen D'Antonio, who's the Executive Vice President for Shatterproof. His mission is to help businesses and communities educate their constituencies about the disease of addiction and the most effective evidence-based treatment practices available today. Steve is a 2018 Advanced Leadership Fellow from Harvard University, where he learned the latest science on addiction through coursework in neuroscience, psychology, psychopharmacology, and public health. Stephen has been trained in community reinforcement and family training, the most effective approach for family members to get loved ones into treatment. Previously, Stephen had a 30-year career in the private sector where he built, structured, and managed a variety of businesses, where he also held numerous senior leadership roles. I'm also excited to introduce Rhonda Miller. Rhonda understands what it's like to live with the grief experience as a result of a family member's substance use. While recovering from the effects of growing up in a home with alcohol misuse, Rhonda survived 8 years of her son Ben's active opioid addiction, only to face the ultimate loss, her child's tragic accidental overdose death. Rhonda channels her grief into helping others. She founded the nonprofit Speak Up for Ben and the OASIS Community Center, the first recovery center in Pennsylvania exclusively devoted to nurturing families impacted by a loved one's substance use. Rhonda is credentialed by the Pennsylvania Certification Board as a certified family recovery specialist, by world-renowned grief expert David Kessler as a certified grief educator, and by the Grief Recovery Institute as a certified grief recovery method specialist. Rhonda uses her expertise and lived experience to help families find hope for their own personal recovery from the effects of a loved one's addiction. So thank you, Stephen and Rhonda, for joining us today. Really excited to jump in. And while I'd love for you to also sort of introduce yourself and what brings you here today, I want to start with an overarching question that I think will get the ball rolling, and certainly I know is something that is sort of near and dear to each of your hearts. So I'll first start by asking, I've heard each of you discuss addiction as a family disease. Could you describe what you mean when you say that, and how your family has been affected by addiction, both while you were addressing and are addressing your family member's substance use, and also how it affected your family? So maybe Stephen, I'll start with you, and then Rhonda would love to hear from you, and then we'll have a little bit of a dialogue.
Sure. Well, thank you, Matt, for the introduction. And I'm looking at the chat. I want to thank everybody who's on this call, and also people who are sharing. It's a really important thing to do, as you all know, and I'll do that right now also. So yeah, I had a 30-year career working on Wall Street. I had some significant jobs, and along the way, the youngest of my 5 children ended up with a very severe alcohol use disorder, which almost killed him 4 times by the time he was 17. God was with us, and a lot of amazing people in the treatment industry, and some incredible parents, and that helped support us. And now he's got over 6 years of continuous recovery. He's 24, and he's definitely our family miracle. But with respect to the family question, I had always heard that this was, really a family disease, and I didn't really understand it, because it was really just my son, who was suffering from an alcohol use disorder. But as I went through the process, it became really clear that it had a dramatic impact on my family, starting with my marriage. The tension between the two of us was so incredible. I was more of a softie, more of an enabler, if you will, and my wife was, chain him down, lock him down, and we both literally thought we were saving his life by our approach, and we just couldn't agree. And as a lot of you who are clinicians would know, what happens there is that as we were fighting and trying to impose our will on each other, the disease was thriving within my son and manifesting itself in some very dangerous ways. At the same time, while it was occupying all of our time and effort and emotion and energy, there was a lot of things going on with our kids. So the youngest had great relationships with his older siblings, and those relationships, as often happens, deteriorated. And it created a lot of pain amongst the other children in the family. It was guilt because some of the older siblings bought him alcohol and really kind of encouraged him in the beginning, and so there was a lot of guilt. And then there was fear, that our family was going to break apart. There's probably disappointment in me as the father who, was really viewed as the solution person, and I really didn't have any answers. And so, there's no doubt that this disease, starting at the top, in our family, the marriage, and straight through to all the different relationships, had a huge impact on all of us.
Rhonda, I'll turn it over to you to discuss addiction as a family disease.
Yeah, well, thank you again, Matt and Ashley, and Michelle, and Steve for being part of this presentation today. I'm just so happy that we're discussing this very important topic of family and how families are impacted by addiction. I can agree with so much of what Steve just shared, how addiction just impacts the entire family system. Everyone suffers. It's not just the person with the addiction. Everybody is impacted. Relationships become strained, unhealthy communication patterns happen, trust is broken, fear grips the entire family as anxiety seems to rule all the interactions. And my story began earlier with my own childhood, being raised by active alcoholics, and the family system, how it was impacted there. I did a lot of work on myself before I had my own children, but after having two boys, our youngest son, Ben, developed an addiction in his teenage years. And it was very, very difficult for us to find help and resources for him. And it was very difficult for him to communicate what was going on. Teenagers have a great deal of difficulty expressing their feelings as it is, and then add the layer of addiction to it. Yes, it impacted my marriage. I was on high alert all the time. And I kicked into case management mode, just, trying to manage my son and his addiction and find resources, insurance companies, looking for education and support. It completely took over my life.
Yeah, thank you both for sharing that. And I think it adds some depth to the introduction and why we're here discussing this topic. Obviously, in the introduction and sort of what you've each shared, it's really trying and difficult times when a family member is working through this, and clearly it has immense effects on your network and family members. And certainly from what I've seen in the work that I've done, it results in family members, community members, friends often pulling away from a really challenging situation if they feel like they can't help. And so I'd love to spend a few minutes just discussing the importance of rebuilding or establishing that support system as a caregiver, as a family member who's supporting someone with a substance use disorder. And what are some lessons that you've learned as you've worked through that? And maybe Rhonda, let's start with you, and then Steve, I'd be happy if you could chime in after that.
Sure.
When we first learned that Ben was using and abusing substances, I immediately reached out to my closest friends who have never experienced anything like this. They were completely bewildered. They didn't know what to do or how to give me any kind of direction or support. I turned to my faith community looking for leadership, direction from the ministers. And again, not all clergy are educated on addiction. So I wasn't able to get really good direction there. Ultimately, I was working with a therapist, and not even every therapist is educated in addiction. So it's so important that you seek out accurate information, do a lot of research. There's a lot of information available today, and reach out and find support groups. I cannot emphasize that enough. I did not do that early on well. I thought I could manage it. When Ben seemed to be improving, I sort of became a little lackadaisical. Oh, I don't need to keep going to these groups because he's doing well, therefore I'm doing well. Well, that proved to be very, very wrong. When things got really bad in Ben's life with this addiction, I ran to the rooms of Naranon, Al-Anon, Codependents Anonymous, Adult Children of Alcoholics, and a local family education group. That's where I drew my strength by working with people who understood addiction and were able to support me through it. Unfortunately, family members weren't able to do that. Friends kind of distanced themselves as things started spiraling down with Ben.
That's a great suggestion, Rhonda. When I look back to the early days, my son was 16, and we got really lucky. We ended up with Northwell, with their flagship outpatient treatment center. And as I was sitting in the rooms, listening to the counselors and listening to other families, the first thing that I would say is I just felt so isolated and so alone, especially with respect to, my friends, my family members. We had gone through this with my older brother, but it was just a totally different thing going through it as a parent. There was so many things going on in my brain, the least of which was hope. And so, one of the things that I would say about this is there's, and I'm now a volunteer at Northwell working with the social workers. And the number one thing that happens when people walk in that room for the first time is, first of all, they're skeptical, which I was. That group help, is actually something that's viable. But the other thing is they just feel like I did, so isolated and so alone. And what happens within 2 or 3 meetings is that I figured out, and other people figure out pretty quickly, that, oh my God, these people are going through the same thing I'm going through. Even though it feels different, it feels like your situation is unique. It turns out that there's an awful lot of stuff that is consistent across families, across substances of choice. It's the behavioral things that are so similar, and how do you respond to that? Those answers are also similar. So I could not agree more with Rhonda that even though it was my last choice, starting in the process of asking for help and getting involved in groups. For me, the groups that were the most powerful were groups that were run by professional clinicians with parents in the room, where they allowed crosstalk. And I'm not saying anything negative about the other meetings. I mean, my wife went to Al-Anon, still does, swears by it. It was great for her. But for me, being in a room with a professional clinician and experienced parents who went through what I went through, or were going through what I was going through, was unbelievably powerful. And in some ways I found my people. Even though I'm very close with my siblings, it was really hard for me to talk about, what was going on with my youngest, because they just didn't understand the behavioral health issue and, what it meant. A lot of times the answer would be, well, why don't you just shut it down? Why don't you just ground him? Why don't you just do this? Why don't you just do that? And, those things, in moderation or at the right time, might make some sense. But generally speaking, people don't really have a very good understanding of what this problem is and how big and powerful it is, unless they're going through it or unless they're trained in it. And so, I would say that support groups are a really, really big deal. And what's funny about it is that I've created some lifelong friendships with people that I've gone to these meetings with for years. And we've actually done some ventures together to create tools that help other families. So, I think that it's probably one of the most underrated, incredible assets that are out there, which are support groups, and self-help support groups, and also groups that are run by professionals.
Mm-hmm.
Yeah, and I'd love to sort of extend the question a little bit. I think each of you mentioned in your remarks folks who were not understanding, that were close in your life, that were stigmatizing to your children, or might have pushed them away or pushed you away. And I think for a lot of people at the start of this journey with their children or loved ones, there's a desire to try to bring those people back in. And I'd love to kind of hear your thoughts on when to, for the safety, and the mental health of yourself, or for your loved one, when do you and how do you make that decision and think through when to distance yourself potentially from people who are causing harm to your situation and what you're trying to solve, if that makes sense.
Yeah, I mean, I could start. That wasn't a huge problem for me, but what was a problem was the culture in my broader family. So I live in a town with my 5 brothers and sisters. There's, 19 grandchildren. We get together, for every holiday, made up holidays, you name it. Like, we like to be together. But alcohol was central. And so it was a really big deal that my son was beginning the whole process of recovery, and alcohol was so central to the family, to the gatherings, to everything that we did socially, as a family unit, and even amongst the teenagers. So, you can imagine, a Christmas celebration, we go over to my brother's house and the kids would be down in the basement, drinking. And in fact, right before my son got into treatment, he literally got blackout drunk as a 15-year-old at one of our family Christmas parties. And so what I ended up doing was I had, the following Memorial Day, my son had just gotten into treatment. I, was throwing the Memorial Day barbecue. And typically there would have been cases and cases of beer on ice. And I just, and white wine. And I basically said, having the party, everybody's invited, but there's going to be no alcohol served. And in my case, it was reasonably well received. And what I can say is that after a few years of my son getting into recovery and doing well, and then a few other family members kind of having a few faulty steps, where alcohol was definitely a problem for them. As a family, a broader family, we started taking down the amount of alcohol that was available at other people's homes and other gatherings. So it did take a while. At my house, it was sort of immediate because I was uncomfortable. Even though my son was saying to me, I don't want to be the cause to ruin all the fun and blah, blah, blah. I just took it on myself and I said, it's not you, it's me. I'm not comfortable having alcohol served in our house at all. And, it's not about you, it's about me. And then later it became about my siblings, and they all agreed that we need to cut down. So we didn't have the shame and all of those things because my brother went through it. He was 40 years in recovery. But the cultural thing was a big thing to change in my family.
Rhonda, I'd love to hear from you as well if you're willing to share.
Yeah, I didn't have the same experience that Stephen had because I don't have family in the area. Both my husband's family and my family all live out of state, so we didn't have those kind of gatherings, and alcohol was never really part of our family culture. Anyway, during Ben's addiction, we basically were very selective with who we shared what was going on with our son for the sake of protection of his need for confidentiality, and simply because we received some really bad advice from people who just didn't understand. My own family, growing up in an alcoholic home, various degrees, different family members have abstained from alcohol or drugs. And so they were quick to tell me how it's done. And they clearly didn't have a serious addiction like Ben did, and an opioid addiction. For me, after losing Ben is when we were very open about how he died. He was 23 years old, 1 week before his 24th birthday, healthy young man. We felt that it was really important to be honest in our community and with all of our family and friends and neighbors. And it did cost us a lot of relationships. A lot of people left. Family members, both sides of the family, walked away. Neighbors distanced themselves. But at the same time, many people in the community have come forward and said, thank you so much for sharing your story, because we have a problem at home and we didn't know where to turn for help. And your story by by sharing it, dismantled the fears and anxiety we have. We can ask for help now.
Yeah, it's I'd love to thank you. I'd love to pivot the conversation just slightly to something that I think a lot of folks, especially parents that are working through an addiction with their child, think about quite a bit. And I'd love to hear both of your perspectives on it. I think it's very natural for parents to continue to create expectations for their children, at any point in their life, but still throughout when they're working through and addressing their substance use disorder. I'd love to hear a little bit about maybe not specifically what the change in expectations was, but even the process and reevaluating those for you, and how would you encourage other parents to sort of rethink and better kind of address what expectations are right for their child who's now dealing with a serious disease. Maybe Rhonda, we can start with you.
Yeah, so of course, at the very beginning of Ben's addiction, before it was really a serious opioid addiction, when he was using other substances, I had very little education, very little knowledge about addiction. And quite frankly, this was around 2008, 2009. There wasn't a lot of information out there, and the people weren't openly discussing it in the same degree that people are today. So, I had great hopes that this was just sort of like, once we got Ben into this outpatient program, that's it. This is going to be the magic bullet. It's going to change things, and he's going to be back on track. Once we got Ben to this therapist, who's the expert in the community on addictions, that's going to be what changes the game. Once we get Ben to change his friends and his social circles and start developing more healthy relationships, that's going to be what changes. So early on, I had great expectation that any one of those things was going to be what changes the outcome for Ben. Ben's disease progressed rapidly, and he had a very, very serious, very severe opioid addiction. It was not easy for him to maintain any level of sobriety longer than 6 weeks. So with each attempt at sobriety, or with each attempt at on his end to make steps to move his life forward, and then having those setbacks, it changed my expectations just incrementally, just by degrees. I slowly changed. And initially it was great expectations that he would graduate high school, get that soccer scholarship he was working towards, go on to college, get a degree, and launch a career that he was passionate about, finding a healthy mate, marrying, having children. All of those dreams that most parents have for their child slowly began to readjust. Ultimately, I came to a point of acceptance that Ben had a very serious medical disorder. And for him, just getting out of bed and caring for himself each day, doing what he needed to do, that's what my hopes and expectations were, that he would just do what he needed to do that day to take care of himself, not worry about the grand life plans and goals. All of that fell to the wayside, and it was his health first priority. Unfortunately, Ben had great difficulty with his own expectations. He saw what all his peers were doing, saw it on Facebook and social media, and he wanted to keep up with them. So it was very difficult for him to accept that he had a medical disease that needed attention, and that he needed to prioritize that over everything else.
Yeah, I mean, Rhonda, you described exactly what happens. So when people ask me about expectations and dealing with this disease, when someone has a severe substance use disorder, I say that substance use disorder is an expectations shredder. You don't have to decide to change your expectations. You're just going to get there. Because for me, I was on my knees praying, begging for my son to survive and to just get healthy. And so everything just falls away, because the only thing that matters, it's so dangerous and it's so scary. And it's so overwhelming, is that's all you want. That's the only thing that matters. And so, I had a friend who described it, she said, I was on my knees, I would crawl through glass just to have some semblance of, a pathway to health. And so, and obviously we know there's good news that people do get healthy. It doesn't always happen, and there's a lot of tragedy. But during the process, my expectations, most people's expectations, basically fall to the least common denominator. And I would say it's also really important for parents to not carry the burden of high expectations when you're dealing with a behavioral health issue. Just a simple thing, like I remember the holidays, and, effectively my son blew up, a couple of our, holiday seasons, by his behavior and fights with his siblings. And so going into a holiday with high expectations, that it's going to be, a wonderful, warm family period when you have this uninvited guest called addiction that can show up and blow everything up, is setting yourself up for, things not going according to plan and blowing up your expectations. So one of the things that experienced parents talk about a lot is just reducing your expectations early, focusing on the one thing that matters, which is the addiction, and doing everything you can to try and help your loved one work on their recovery, and get rid of the rest of the baggage, because the rest of the baggage is doing you no good, when really you need one focus, and the focus is health and recovery around the substance.
Great. I'd love to, just looking at time, I know we want to make sure to spend some time answering questions from all of the participants. So I actually want to sort of pivot the conversation to resources. And Steve, I'd love to start with you. I know I've heard you speak about this quite a bit, and I'd love to hear a little bit about your experience using tools such as detachment and boundary setting in a compassionate way when you're interacting with your loved one who's working through a substance use disorder. And I think for a lot of parents and a lot of loved ones, this is one of the most, if not the most difficult things that they work through. And just walk me through a little bit how you learned that skill, how you built it up, critical moments where you utilized it.
Yeah. So I was not a quick study. So it took me a little bit of time to understand. And, it turns out that, look, I was fortunate. We had, tremendous treatment services. In fact, right there in the state of Pennsylvania, my son went to Caregivers Treatment Center, which is amazing. I can never pay back my debt of gratitude to that organization. But at the family education weekend, one of the counselors said to the parents who were visiting, we want you to write a letter from you to the disease of addiction. And it was such an odd request, but all of a sudden this energy filled into my body where I was like, OMG, damn. I've been looking to be angry at something or someone, and that's it. And I started writing, dear addiction, F you, you're trying to kill my son. You're trying to ruin my marriage. You're trying to destroy my family. You're trying to destroy my son's life. I hate you as much as anyone can hate anything. And I went on, and I talked about how, there is a solution, and that solution is sobriety, and my son's going to beat you. But what it did was, it took me away from this whole notion of, who's to blame? Why isn't my son behaving better? To, it's a disease. And all of these behaviors that are outliers, all of these things that you're doing that are so hurtful, the things that he says to me that are so difficult to hear, is really addiction talking. And so once I got to the point where when he would do things and say things where I wouldn't react emotionally, but I would react in a way that was like, oh, okay, this is what addiction's throwing at me today, it gave me a lot more power to focus on what I needed to focus on, which was the disease of addiction. Then the next lesson was, okay, what is your toolkit? And for parents, the only tools that I have ever seen, really are setting boundaries and consequences and then sticking to them. And so I had some very serious moments with my son where, I set some boundaries, and in the beginning, I wasn't very good at holding to him. He was very good at talking me out of the consequences. But in the end, we set some really harsh, difficult boundaries for my son's behavior, and it did create some change. The only other thing that I will say about your tools is positive reinforcement is just as important. So the toughest lesson for me was he was doing bad things, behavioral wise, and he was doing some good things because he was a good kid fundamentally. And so being able to, at the same time, maybe even the same day, maybe even in the same hour, call out the negative behavior and then call out the good behavior was really difficult. And it's one of the reasons why, in my view, having professionals or experienced parents involved in the process is so important, because they have perspective, they have judgment, they've been there before, and they can help people with these tools. The tools sound simple, but they're not actually easy to implement in the heat of the battle. But those are the main things. It's having detachment from the disease, knowing it's a disease, setting boundaries and consequences around those boundaries, and then also positive reinforcements for those behaviors that are actually good behaviors that you want them to repeat.
Perfect. Thanks, Stephen. And Rhonda, I'll leave you with the last sort of formal question before we bring it to the full group. But I'd love to talk a little bit about OASIS being the only recovery center for families in the country. And I'd love to just dig in and kind of offer sort of a moment of hope. Obviously, this has been a really difficult conversation. What makes the model unique, and why is it such an exciting resource to address all these issues that we've talked about today?
Yeah, my family and I established a nonprofit, Speak Up for Ben, a couple years after we lost Ben, and then quickly were able to put together a program here in Northampton County called the OASIS Community Center. It is the first and only recovery center exclusively devoted to supporting families. And that's what makes it unique. And when I say families, I mean anybody. It could be families of blood or friendship, neighbors, coworkers, anybody who has a concerned other of somebody with addiction. So what we're doing is providing support at the basic level. We believe that the family system as a whole needs to be treated, that the person with a substance use disorder, if they're treated in isolation, there's a huge component that we're missing, a huge component of underutilized resource by engaging the entire family. So we work with programs here. Everything we have is free, family counseling, all kinds of support groups and whatnot, specifically to strengthen families, to strengthen those communications, to teach the positive communication strategies like Steve talked about with CRAFT, new models like Smart Recovery that we've introduced, emphasizing healing in relationships and restoring relationships. So that is something that's very unique. It hasn't been done, to my knowledge, anywhere in the nation, but certainly not in Pennsylvania. We need to see more supports for families this way.
Wonderful. Thank you both. And I think I hope all the participants, and I imagine based on the conversation that they recognize it, but YouTube talks so eloquently about what is a really, really challenging situation and time for both of you. So it's not lost on me that every time we hold a meeting like this, that you're sharing out and putting your energy out in the world. So thank you for doing that. And I know the participants are learning and really absorbing a lot of this. So I will say that we will kind of open the chat line, so to speak. And Michelle will be bringing in some questions. We have about 10 minutes So please, please share those either directly with her or in the chat line, and we'll certainly try to get to as many as we can. But just acknowledging that I know we won't be able to get to all of them. So I'll start with one that I think is hopefully more of a practical kind of question, but I know there's not a perfect answer. Steve, you talked about the importance of finding support groups that had licensed clinicians involved. One person asked, how do you go about finding those and sort of searching those out relative to other groups? So do you have any sort of tricks or mechanisms that you use to make sure that that person was in the room?
Yeah, I saw that question. Amanda Jackson asked it. It's a great question. And so look, it's the issue with these are that they're reasonably rare. I know that Hazleton Betty Ford has an online one that's live, and it's something that that they're quite proud of. Karen Treatment Center has a number of them. But the truth of the matter is that, there's not enough. And so they're not that easy to find. Because of that, and I hope you don't mind me going into this, Matthew, but I think it's important. Because of that, myself and two other fathers were the beneficiaries of being in a Karen Treatment Center group run by a top clinician in New York City for a number of years. And what we decided to do was to partner with Karen Treatment Centers. So we talked to Doug Tiemann, the CEO, the clinical director, Dave Rotenberg. And what we did was we created a podcast that essentially was a parent support group meeting that was that also was participated. We also had a participant from Karen Treatment Center who was a top clinician around the topic. And this podcast, which is available, you can get it on your phone right now. You can get it on iTunes. You can get it on Google Play, etc. It's called My Child and Addiction with an ampersand. And we have about 40 different podcasts, and it's all the topics that come up. So it's co-occurring disorders, it's impact on family, it's the emotional roller coaster. The latest one that we did, which is going to be released soon, I think it's really important because these rooms are dominated by mothers and women, is fatherhood, being dad. And it was 8 dads who were in this meeting with Dave Rotenberg, the chief clinical officer from Karen, talking about how difficult it is to be vulnerable and to share and, to be in the position that we were in. So this is 8 parents being really raw, vulnerable, sharing, about what it's like being a parent, what are the tricks. So it's educational, it's supportive, and I think it's ubiquitous because it's available electronically.
Perfect, Rhonda. I'd love to turn to you if you have any additional thoughts to add about, finding some of these support options. Otherwise, I have a few more questions coming in.
Yes, absolutely. One of the things that the COVID pandemic gave us is the ability to connect virtually anywhere around the country and even around the world. So previous to that, many of us were just limited to what we could find in our community, and it was very difficult. But thanks to that, we have Zoom meetings, we have podcasts, we have webinars such as this. And here at OASIS Community Center, being a center exclusively for family recovery support, we have a resource page. Steve's podcast is listed on that page as a resource, and we try and put national and local resources that people can access directly on that page. So that's oasisbethlehem.org resource page.
Great. So I have another question that I thought was pretty interesting, and someone described a scenario, and I think it's a scenario that's probably one that many deal with, and they talked through how their parents are deeply kind of codependent and almost enmeshed with their adult brother's substance use disorder. And they talk about how the verbal and emotional abuse has gotten to a point where there's not a lot else to do. I wonder about how one can show support in that scenario. but also express their concern. And so this is sort of the dynamic of talking with someone else in your family who's also dealing with someone's substance use disorder, but in a way that you may know isn't productive. How do you, continue to work through that while also challenging what might be, difficult or backwards or sort of stigmatizing approaches that might not line up with your understanding of the best approach? Rhonda, maybe we'll start with you.
So to understand your question, what would I say to a family who has a sibling, an adult sibling, who's struggling because their sibling is addicted?
Or I guess even sort of broadening it out, there's a lot of people who try to support someone, who's a loved one with a substance use disorder. And if you feel like someone else in that family unit or community unit isn't going about things the right way, how do you have a conversation with them or dialogue in a way where you can still sort of appreciate the fact that they're trying to help someone and their addiction while also, communicating that the approach may not be the right one? Does that make sense?
Yeah, sure. That's very challenging.
I know that's not a simple question.
And it's a very challenging situation. So what I like to do is speak from my own personal experience because I made a lot of mistakes and I had a lot of misinformation early on. So what I would do with those individuals is just share my experience, what I found worked and what I found didn't work. And then hopefully the dialogue would open up so that I could share where to find some fantastic resources so that individual can learn healthier communication patterns. But sharing from my own experience rather than lecturing or telling somebody what to do is always more effective.
That's 100% right. I statements, not you statements. So Rhonda nailed it. The fact is, once you start accusing them, they're going to get defensive. And as soon as you start with an I statement and as Rhonda said, made yourself vulnerable by talking about your mistakes, it's powerful. And, as a volunteer at Northwell, I constantly get feedback from the social workers that I'm not saying anything different than they are, but I'm coming from the vantage point of I've been there, I've made the mistakes. This is what I tried, it didn't work. This is what I tried, it did work, is really powerful. And so I think Rhonda nailed it.
Perfect. So there are a few more questions, but I'm getting a lot of sort of questions about resources. And so I know the last 10, 11 minutes are really going to be very, very focused on you all expanding a little bit about all the things we talked about today, OASIS and, Steve, Just 5 and My Childhood Addiction. So I'm going to step away and really kind of turn it over to Michelle and Steve and Rhonda to walk through some of those resources. I just want to emphasize again how appreciative we are of everyone taking the time today. This is a really amazing outpouring of support from the community in terms of attending this. We will continue to be offering these webinars as a part of the Life Unites Us campaign over the next year. And we would really welcome any feedback on how we can be more supportive and helpful to common issues that you all are working through. So thanks again, Steve and Rhonda. It's been an absolute pleasure to be able to help kind of moderate this conversation and work everyone through this. And Michelle, I'll turn it back to you so that we can talk through resources and wrap up the conversation today.
Excellent. Thank you so much. I am going to invite Rhonda to actually come forward and present on OASIS.
Mm-hmm. Yeah, well, thank you. I just wanted to let everybody know that OASIS Community Center is a free resource. We're situated physically in Northampton County, eastern side of the state, but because of the pandemic, most of our programs have been put on Zoom. So many of our programs are offered both virtually and in person in a hybrid format. We have a team of certified family recovery specialists that will walk family members through addiction education and help them develop a recovery wellness plan, which is really important. It's very important to differentiate that family members have their own recovery program to work independent of their loved one's recovery. So whether your loved one has found sobriety and is in recovery, they're not in recovery, or like me, maybe you lost your loved one, you can recover too. And that's what we're about here. So we have professionally facilitated by licensed professional counselors, a family counseling group, grief and loss support groups. We have many different family recovery peer support groups, both 12 steps such as adult children of alcoholics, Al-Anon, Codependents Anonymous, and recently we added Families Anonymous. But we also have non-12 step programs because 12 steps are not for everyone. And sometimes people need to try something different or maybe supplement their program. So we offer smart recovery for friends and families. And we do a lot of partnerships with other community organizations and bring other programming here to OASIS. A big part of what we do too is help families reestablish social connections. Oftentimes we have become isolated. We've been either disconnected from our social supports by the fact that our loved ones have addictions, or just maybe we need to reestablish healthier relationships. So we have a whole program here with creative activities, fun activities, social activities, and we even have a retreat that we're planning in May. So all of these programs are here at OASIS, and I just encourage you to log on to our website and inquire if any of these programs are interesting to you. Perhaps we can offer you a virtual option if you're out of the area, and the programs are free. OASIS Community Center offers free support. Now I believe we have a video about OASIS that we're going to show for 1 minute, and I'm going to turn that over to Michelle.
OASIS, a peaceful area in the midst of a difficult, troubled situation.
OASIS, Healing Center for Families, so that they would have the support to cope with their loss.
The OASIS Community Center, an example of community leadership, taking their profound, unimaginable grief and directing it in a positive way that will bring some measure of peace and comfort to other families. We are not giving up on anyone. We are not giving up on anyone.
It's a picture-perfect setting for us to experience healing in community. Opportunities, activities, support, information, serenity. OASIS.
Thank you so much. I've also dropped a pamphlet for the OASIS Community Center into the chat if you would like to read more. And now I'd like to pass it to Stephen to present on some of the other resources available.
Sure. So first of all, I'm going to talk about 3 different resources. The first one is an educational platform. It's online. It is basically, it was a labor of love when I first joined Shatterproof. One of the issues that I had when I first started the journey with my son was I was so frustrated that I could not get simple, basic information about addiction in an easy way. If I went to SAMHSA, I was overwhelmed. 6 years in, I'm still overwhelmed by SAMHSA's website. It's not bite-sized, and it's very, very difficult to get your arms around information. So when I joined Shatterproof, I had been collecting things that I thought everybody should know about addiction, the general public, as well as people who might be starting in the process. And I joined with Shatterproof, who had professionals from the addiction field, and we put together this training. Just to tell you a couple of things about the training. First of all, it's available to all of you for free because the state of Pennsylvania purchased it. It's you can see on the upper right, just5.org/PA-workforce. Pennsylvania is a partner of ours. We sell this to companies. Our first company was JP Morgan globally, 250,000 employees. We've sold it to large health systems like Northwell and Sutter Health out in California. United Healthcare rolled it out to their employees. New York City rolled it out to their employees. We have 61 partners in the US. And probably the most interesting of all the partners is Hazelton Betty Ford, who has their own publishing company They use this training for anyone who calls their 1-800 call line and is not ready for services, but needs to get educated about addiction. They send them to this Just 5 training. They've sent us thousands of people. A couple of other things. There are 6 lessons. The science of addiction basically gives people the neuroscience around what it is and what it isn't. Are you at risk is a prevention lesson. Who's vulnerable and why, and what you can do about it. Dangers of opioids. I don't have to tell this group, but we lay it out. What are the dangers of opioids? What are the common opioids? What are substitutes for opioids? How do you manage your medicine cabinet? Signs, symptoms, and treatment. Here we roll out the DSM-5. I don't know why the whole country doesn't know about DSM-5. It's so simple. There's 11 yes or no questions that will tell you whether there's a problem, there's not a problem, how you can help. This is how you can help a loved one. It's what every clinician in the country would tell you can do. And the gift of recovery, because it's so dark and negative and everything is no about addiction, we wanted to share that there are beautiful stories of recovery, millions of people in recovery, and here we share some incredible stories. We have efficacy on this training. We have statistically significant impact on how you can help, on understanding, being able to recognize an addiction, on how to reduce the risk of addiction for vulnerable people, and in reducing stigma. So again, this is an asset that we created. We sell to companies for $10,000. State of Pennsylvania is rolling it out to anybody who wants to use it for free. Next item. Can we go to the next? There we go. Shatterproof, find help. I get, as you could probably imagine, I get a lot of phone calls from people that I know, people that I don't know, that are looking for guidance on what to do about a loved one that they're worried about. It is shocking to me that in almost every single one of the phone calls, when I ask the question, are you sure they have an addiction? The people are not sure. The level of denial, the level of lack of understanding of what addiction is and what it isn't is huge. And so on this resource, find help at Shatterproof. So shatterproof.org, look in the find help section. One of the first things we show people is the DSM-5, that people can go through and then they can figure out whether or not there's a problem. The second question then is, okay, now I see that there's a problem. What do I do about it? Where do I send them? How do I think about that? That's another really huge issue. There's a lot of misinformation, especially if you go on the internet. The only treatment centers that are advertised on the internet are residential treatment centers that cost a lot of money. And it turns out that a huge percentage of people who need help shouldn't start at residential. 56% of people, according to our data, should start at outpatient, in either outpatient treatment or intensive outpatient treatment. 2 years ago, I cold called the American Society for Addiction Medicine and said, look, you guys have the ASAM criteria. You've been studying this question for 40 years, but a lot of consumers never get access to this. You should create a consumer tool. They agreed. We created the consumer tool with them and a health tech company called Bamboo Health. We rolled it out a little over a year ago, and we've had something like 8,000 people do assessments, and which leads them to the right level of care, either outpatient, intensive outpatient, residential. It tells them whether they need detox. It tells them whether or not they need mental health monitoring or mental health treatment. It is really comprehensive. That tool is the second thing that is available in our Find Help section. And I think it's a really big deal because it will avoid the problem of people going to the wrong level of care, which not only could be really expensive, but it can also be detrimental. If people go to too restrictive of care, it can have a negative effect, believe it or not. So that tool is called the Addiction Treatment Needs Assessment Tool. And it's also in our Find Help section. So when people call, they have these questions, not sure if there's a problem, DSM-5. Okay, now what do I do? Aetna tells them what to do. So I think that's the second thing that would be really valuable. And then the third asset I've already talked about, if you can pull it up, which is the podcast, My Child and Addiction. We had, it says 75,000 downloads. We're up to 110,000 downloads now. The feedback is unbelievable. So many people have said this is life-saving. We have people from all over the world. I think there's like 15 countries outside of the US that are represented. It really is powerful and it's worth checking out. So I'll stop there. Those are the 3 resources that I recommend.
Thank you so much. I would like to thank both of our speakers, Rhonda and Stephen, today for joining us, for your honesty, for your participation, for sharing all of these resources with our guests. And I'd also like to ask you all to check out the chat box. Some really great information has been shared there. And I'll be sure to leave the presentation up for a little bit longer so you guys can go back and scroll through some of the responses that were offered by our attendees. When you do leave this event, a survey link will automatically appear, but I can also drop that into the chat box. It's just really helpful for us to get feedback on what kind of events we should be holding in the future, if there are any other resources that we can make available to you all, and how best to improve the campaign moving forward. But I would just like to thank you all again for your time and for your interest. Take care, everyone, and have a good day.